Welcome back. You're live with Expresso on a hugely important day, not just for South Africa, but the world, as we celebrate and commemorate World AIDS Day, a day that aims to honour AIDS victims first off, but also focuses on issues surrounding HIV and AIDS prevention. Now, the Western Cape Health Minister, Dr. Nomafrench Mbombo, will be leading the charge in raising awareness for World AIDS Day at the Cape Town station later today. And Dr. Nomafrench Mbombo now joins us in studio. Thank you so much for taking a time out on a very busy day today. A huge campaign, Hands Up for HIV Prevention. There seems to be a renewed vigour, drive behind increasing, yes, the prevention of the spread, but also giving us a fine outline of when we can end it. But talk to us about the campaign and what will be happening today.
The campaign is all about, it is in our hands to end HIV and TB. Meaning now it goes beyond where it becomes only the health system's problem, but everyone has got a role to play in terms of the usage of the condoms, in terms of one partner, in terms of the male circumcision, and all of those. So today, for the whole of the Western Cape, we are busy. We have got stalls throughout, but I'll be going to Cape Town Stadium, where people will have an opportunity to go for HIV testing, people if they want more information, and also about where people probably they can write in their hands and then just take a picture and then post it in our Facebook page so that actually the whole world, because it's part of the campaign by the United Nations. So it's, I don't want to say it's exciting because it's a disease and there's a lot of money that is being put around that. But I think for when everybody, all of us, become everyone where we are able to fight the disease. And that's the point.
I think what is exciting is this renewed momentum behind providing a finish line, that it's our generation, that it's not 4 or 5 generations ahead of us. We have set the finite goal of having an AIDS-free generation by 2030. Do you think we can do that? Is it just a marketing gimmick to get more people involved, or is this something that we really can achieve?
We can achieve because those projections are based on evidence base. We can achieve, but it needs the whole of society. Government alone cannot be able to do it. The international funders, the donors cannot do it. They cannot do it alone. It needs also a commitment from the people themselves. Because you can dish out as many condoms as you can preach about safe sex as much as you can. But again, it needs people to take a commitment around that part of it. But also for the society, because in most instances, for example, we've got now HIV new infection among the young girls and women, among the sex workers.
Most disenfranchised.
Yes, so those key populations, for example. So it means, although we have tried to mop the floor through the ARVs, for now, for example, the life expectancy has increased in South Africa because of those ARVs. But having these new HIV infections, it means now we keep on looking at the...
We've got to go back to the core, yeah.
Exactly.
Now, you recently received, because I think of the efforts, a multi-million rand global fund grant to go towards these. How will that money, those funds be used?
The Western Cape received around about 270 plus million rand. Wow. 81 million rand of that is specifically for young girls and women. The project is called Women of Worth. Correct. Because it has been found that they are most vulnerable, but specifically from the 19 to the 24-year-olds, which is the post-adolescents. Because currently we do have the programs from the 10 to the 18-year-olds, so that those who are already at school. But the post-school, and also it's the time when they don't have access to social grants. So they are more vulnerable in terms of transactional sex because of the wanting to access the economy. So we are targeting now those girls as well. So it also needs everybody else because it's a whole issue about also the parenting skills. It's a whole issue about also for us, the health system, where we change our services so that they could be more responsive to be youth-friendly. It also goes about a responsibility around the adults because the issue of the blessers and the blessees, targeting all these young girls, but the most important thing, keeping girls at school, especially in the 10 to the 18-year-olds, because when you are at school and then you go to school even longer, you are at least at a position of being able to negotiate the safe sex.
Insulated in some
Exactly.
way. Dr. Mbombo, thank you so much. I wish we had the entire day to talk, but I know people can obviously connect with you at Cape Town Stadium today.
Yes,
So all
yeah.
the best of luck. We'll put the message out on our social media platform as well and try and spread the word as much as we can. But thank you so much for the efforts you put in personally. And what you're
Hashtag
part with.
HIV prevention.
Hashtag HIV prevention. You'll see our hands on that Facebook page as well. Dr. Mbombo, thank you so much for joining
Thank
us
you.
this morning. And of course, we're going to continue our World AIDS Day conversation throughout the show. This morning, Dr. Darren Green will be joining us for that discussion a little bit later.